Hereditary pancreatic cancer, there are some people that have hereditary pancreatitis and they can be at risk for pancreatic cancer. Sometimes we can see pancreatic cancer associated with some other GI types of cancers like colorectal cancer, and there is a genetic test for that if people fit into those criteria, and then that would have implications for how often they should begin screening for colorectal cancer and some other diseases as well. Now, if you're asking about, do we routinely screen people for pancreatic cancer? We don't routinely screen people for pancreatic cancer, but there are certainly tests that if one suspects pancreatic cancer, we can check out and see if it's a concern. The most common hereditary pancreatic cancers are the ones where they're seen in association with other cancers, where the other cancers are more common than pancreatic cancer. So hereditary syndromes where pancreatic cancer is the primary cancer that one sees are fairly rare. There are no defined guidelines for how those people should be followed, but there are folks that do get followed closely. And sometimes those folks can have yearly imaging or yearly endoscopies to look for pancreatic cancer. This is a disease that oftentimes is picked up when it's already advanced to the point where surgery is not possible. In fact, less than 20% of patients are able to have surgery at the time of diagnosis. This is also a disease where we have some chemotherapy options, but we are sorely in need of better options. And I tell my patients that this is a disease where a clinical trial really makes a lot of sense. Clinical trials aren't appropriate for everyone, but for patients who are motivated to do clinical trials and who are good candidates for clinical trials, this is a disease where it makes a lot of sense because we do not have terrific therapies for this disease.